To me, AI is going to be more like an exoskeleton that humans can strap on.
Is it better that somebody gets an AI agent that isn't 100%, but gets it within 30 seconds or less, or they wait on hold for 10 minutes to get a human? And as you improve your operations with other AI tools to speed up the turnaround time, you also, if you shorten that turnaround time, you now get less calls as well.
If it's mission critical, you need a partner and they need to behave like one.
Exactly.
Hello, everyone. Welcome to Enterprise AI by Colbotics, a conversation series where we speak with enterprise leaders about how they are thinking about AI and how it is shaping real-world operations. I'm Ali Merchant, and today I'm joined by Michael Fritts. Mike is a senior executive in the health information space and has spent his career leading complex healthcare and technology operations, including leadership roles at GE Healthcare and other high growth environments. Mike, it's great to have you here. Thank you for joining us. And to start, for those who may not be familiar with your background, can you share a bit about your journey, how it has shaped the way you think about running large operations?
So my journey is an interesting one. I'm an electrical engineer by training, but I started out, as they say, carrying a tool bag, working on CT and MR scanners out with the clients. So my initial experience was working around patients and clients in the hospitals. And so that really informed my journey in this space over the last roughly 40 years that I've been working in the healthcare space. And I saw firsthand when things go well, how important it is to the outcomes. And when things don't go well, how it can really hurt patients and the clinicians and the hospitals. And so I gained a healthy respect for what it takes to actually run a business, scale a business, create products and services, and make sure that they're repeatable and that they are compliant and that they work as intended and that they're useful and usable by the people out there in the tens of thousands of facilities around the world that are going to use those products and services. So that's really been my journey, is going from that out in the hospital space, individual contributor, all the way through actually having to make the decisions and run the operations that are then going to drive those businesses. And so, the main thing that drives me is it going to help the patient? Is it going to help the clinician? Is it sustainable? Is it supportable? Is it repeatable? Is it scalable?
Absolutely. I think, I concur to that 100%. So, let's start from the basics. So for someone, who's not close to the space, how do release of information operations actually work?
About half of the hospitals and clinics and enterprise hospitals are still doing what they call release of information themselves, and about half use companies to release that information. And the trick is the release of information. When somebody has a lawful legal request for information, they have to present that request properly with the right information. They have to have the correct reasons for wanting it, and they have to be specific about what they're looking to have released, whether that be dates or types of labs or whatever. And so it's very, very important that information gets released correctly. When you think about HIPAA and health information, you want to be 100% compliant and 100% secure. You don't want that information to be hacked. You don't want that information to be released incorrectly. And so hundreds of millions of pages of health information are shared every single year. So it's hard to get that right every single time. But if you bring in the technology in the right way, you train the people the right way, you put in the right processes, and you ensure that there's compliance and security, cybersecurity, you can do a very, very good job of making sure that, if it's an insurance company or it's an individual person who wants their health information, or it's being shared to somebody like Mayo Clinic for continuation of care or cancer care, or it's for a disability claim, or it's for a lawsuit, or it's a subpoena that you're adhering to. It's important that either the hospitals themselves or their agents do that correctly every single time, every single day. And it's a very tough job. But again, if you do it correctly, then you can ensure that health information is shared quickly and accurately and compliantly and securely. And that's what we do in the release of information space, is that we act as agents for these healthcare facilities to make sure that is happening continuously. So there's a lot to it, and to do it right, requires a lot of diligence, a lot of training, and more, a lot of technology. And so that's for our topic today. A lot of what we're attempting to do is get it right even faster and more compliantly with technology. If you look back a year ago where it was at versus where it's at today, and even the latest version of Claude has gotten so much better, but it's not like health information and getting that right. So depending on the severity and the probability of something going very wrong or needing to get it right dictates a bit how you bring in AI into the picture and what it's evolved to. I think it's, you go into two different camps. Are you developing AI tools that you're going to deploy operationally? And so how you define and you clearly lay out the work steps and the work processes to deploy the AI tool. And is it looking for a needle in the haystack? Is it handling and if you're deploying it for something like the needle in the haystack, how are you training that model? Are you using, we're very clearly do not use our clients. So we use what we call synthetic data, right? Created to train that needle in the haystack model, because that's what AI can be very good at, right? You've thought it through, you've tested it, you've rolled it out, you've documented it. You can see that documentation and you have traceability to what it's doing and why it's doing it. And if you want to be able to go back, whether it's the needle in the haystack or it's the daily activities, to go, why did you do what you did, right? Can you go back and say, why did it make that decision? Because the issue with AI, as you know, is it can hallucinate. So you can have, I would call it in the medical terms, false positives or false negatives. It could possibly miss some things that it should have caught, or it could possibly interject things that it shouldn't have been rejected. So again, and that's why the strong belief is you have to have humans in the loop to, both on the development side and then the deployment side, but also the managing and attending to it and having the human making sure that the output and the outcomes are correct. And have you shown what the team that's working on it, that you can see the work they did and how they did it. And then once you deploy it, how do you monitor it, trace it, track it, manage it, have the human in the loop? And to do that across a broader organization, you want to have an AI champion. You want to have AI experts or agents that can help your team better utilize AI and understand it, but also to ensure the consistency, the process, again, the operating mechanisms are there. You don't want it to be a wild, wild west, I guess. There's a bit of that where it's like, hey, AI is this wonderful tool, go out and use it. Well, for us, we don't put information into any old AI. If it's within the company, it's got to be the approved AI platform that we're contracted with, that we can put our information up there and know that it's safe and secure, that our own information is, not even just our clients, right? And then if people are going to use AI for other purposes, that the company information doesn't get loaded to somebody's personal version of Gemini or, Perplexity or, Claude or whatever. You're making sure that people understand, as a policy, don't share company information with just any old AI, and make sure you're using AI correctly. So, and for operations, you have to be very careful that you don't get it wrong or slow it down, right? We're flowing a lot of information very quickly. It's a very high speed production line that you want to get right every single time. So you don't want to deploy AI and then find out that it was putting something out there incorrectly, right? That's the danger. If you don't have humans in the loop, especially, is that you're going to, do the same error a lot if you don't do it right up front and you don't catch it if there's something that it's not doing right.
What are your thoughts a little bit more deeper on that part, meaning AI versus humans?
To me, AI is going to be more like an exoskeleton that humans can strap on. It's a second brain, or it's taking over repetitive tasks, or it's finding patterns in complex, diffuse data sets that would be hard for a human to pluck out. But you still need humans to evaluate it and understand it and make sure, again, it's not hallucinating or it's not missing something. And so there's always going to be a role for the humans in the loop, our ability to scale and do it more quickly, do it more accurately. If we do it right, we're creating superhumans with second brains is what we're doing. And so the people that understand that, embrace it, are the ones that are going to win in this new AI space. A narrow window view of how do I get my AI to help me answer my emails better?
Makes sense. Let's get a little more specific to release of information, operations. Yeah. So there are so many things you do within that operation cycle, from receiving requests for medical records to the end spectrum of it releasing those requests or information around health information.
Mhm.
So there are so many things, from making calls, receiving calls, checking
Yes.
records, sometimes arranging the records in a certain chronology, identifying if there are commingled records. There are like a bunch of things, right?
Mhm.
So your kind of deep experience, right? Where do you see within release of information is the highest leverage and applicability of AI like today?
Again, I think the biggest impactors to start with are, the easiest ones to see and fix or help with are like that incoming information or QAing the outgoing information. The biggest lift will come when we can actually process that information, because that's where the biggest amount of labor is.
I think, that's an interesting take that you mentioned, that on receiving and making calls, the largest part of health information management is a non-voice work, which is records. And, that's what receiving records, identifying what records are required, releasing them, right? That Callbotics is actually born from our other company, AM Infoweb, where we have close to 2,000 people doing exactly this job, right? We also went, our first intuitive move was to build something in AI around that, around the non-voice part of it.
Mhm.
And what we saw was that AI is still not there yet. Maybe in certain small chunks, it is there where it could still manage a small process, maybe moving something from here to there.
Mhm.
Meaning it's health information. You cannot operate at, okay, you know what, 85% accuracy.
Right. Exactly right.
Yeah, right. It has to be 100%. There is no, or at least 98, 99%, which is like human accuracy levels. Otherwise, this doesn't work.
The doctor's notes are in somewhere else. Like, to truly get coverage necessary to manage somebody's health and the prior authorizations, the referrals, and everything else, you have to have coverage across all of the sources of health information. And that's where it gets incredibly tricky, and where a human can understand that, hey, this isn't all of the information. It's not going to satisfy the requirements of the clinician. It's hard to train an AI to understand that aspect of it. So, that's a very good point.
That's what we then spent a lot of time on that when AI was out there a few years back. And then, what we realized was we had one of the best engineers, tech team. We had so much context doing this for 18 years. So then we kind of paused that. And that's when we started working on Callbotics, because this was the other thing which is like very large within health information management and litigation, health information management in the litigation support side, which is records retrieval. You have to make a lot of calls, follow up, make payments. That is what we used to do, and we do actually there for litigation support firms. And then on this side, for the release of information firms, receive those calls, process those inquiries and requests. And I think the reason why it really worked was, there as well, we were only able to automate approximately 80 to 85% calls. But the beautiful thing was, even those 80 to 85% calls, we were able to quality 100% of those, conversations, right?
You have the data, the access to the data. And the thing with calls, it's to your point, when you're talking about calling, for example, inbound calls, when I first started this role, we had a very high dropout rate. People would, and very long wait times, right? So is it better that somebody gets an AI agent that isn't 100%, but gets it within 30 seconds or less, or they wait on hold for 10 minutes to get a human? And if a large percentage of people are waiting online, isn't it much better that they can get immediate access? And you can solve 85% of those, or whatever the number is, even 50%, right? That's one of the things we are bringing in AI agents for call handling, for initial call handling, for general inquiries, right? If it's just, hey, what's the status of my release? You can handle even 50% of those. And if half of your calls are status checks, and you can handle half of those status checks with an AI agent, that's a huge benefit, because then allows your other human agents to focus on the calls that require more in-depth conversations on, it could be a billing question, or it could be a, I need the release immediately because my surgery got moved up, or whatever. There could be something that causes a need for that human in the loop. But for the vast majority of them that are just, hey, I just want to know the status, this is by far and away the best solution. And a lot of people don't want to necessarily talk to a person. They're, as long as it flows nicely, they're fine with it being a chat box or an AI agent or whatever else. And they can use that. Actually, some people don't want human interaction. They prefer it to be something that they're just chatting with something and getting their answer that they want, as long as it happens quickly and accurately.
Correct. Yeah, I think as long as you rightly said, you used a very interesting word. As long as the AI agent has personality, I think that's a very interesting way to put it. Meaning it's able to answer quickly with empathy, understand clearly. You're not talking like it's not talking over you when you are speaking. As long as that comfort is there.
You're pausing for 10 seconds before it answers you or whatever.
Correct. Yeah. Without that lag, you would say.
Well, that's another good point about calling out, right? AI can sit on the phone for half an hour. It doesn't care, right? You don't want a human agent, to sit there for half an hour waiting to get somebody to pick up the phone or whatever. Yeah.
So that's the effectiveness, the financial part of it.
Yeah.
What excites me is that, as you were earlier mentioning, right, it is sometimes provider to provider continuity of care records, where if you're not getting the records, someone is not getting their line of treatment in time.
Exactly right.
Is something where even I think finances and money is aside, you have to make sure that those records are coming in, not only coming in time. So we knew that we certainly don't mind talking to an AI agent. And the funny thing is that, and then the second part was that what if an individual consumer or customer calls it, right? What about that? Right. And I think there also we were tracking, meaning their CSAT ratios. And we saw that after a call, we would take a survey just on a small queue just to get that feel along with our partner that are people happy. And I think they were happy most of the time. Mm-hmm. Even if someone kind of, even if it was an AI agent, because it was so quick, they were like really happy. And then what we saw was that over time, as I said, around 80% of the calls we were able to automate for them. And then for the rest of the 20%, like you were saying, your human teams have time to really invest on those complicated cases, really help customers that are, struggling out there, right? So wherever the AI agent couldn't handle with full context, it would transfer that call to a human agent. And now the customer that is calling in doesn't need to repeat themselves. They can see the context, they can see the suggestions that the AI agent is making. Just because the AI agent doesn't have access to that data, they need a human to kind of, manage this. The humans are now doing more proactive job. They are also very happy that every day they are kind of helping someone. Solving real problems for people gives this immense amount of satisfaction, right?
For sure. So rather than picking up from somebody that was on hold for 10 minutes, that's already frustrated and is, impatient and wants immediate answers. And that then leads to burnout with call center employees, right? If you can shift that to where you handle the direct inquiries quickly and effectively, and then it's only the calls that really need that attention and that help, and that person has the time and ability to calmly help that person, and that person is not frustrated because they were able to get through to a human agent to get their issue resolved. That's what you want. You want to be able to make sure that somebody that's, they're calling in for the third time because they, again, they're going into surgery or something like that. And to your point, when it's a provider to provider retrieval, they don't have it. They're doing it for treatment. If that information didn't come through or they're not sure of it, you're going to actual doctors are going to pick up the phone and have to call to try and follow up on it because it's important to them. And the truth is it's your frontline touch point with patients who then talk to the facilities that they're being treated at. And that's one of the things that gets to CEOs of those facilities faster than anything, and heads of operations and things like that in our client base. If the patients are frustrated with how calls are being handled, or that it's, they can tell it's somebody that's got an accent and they get frustrated by that because they can't understand, you can quickly see that escalating and becoming a very visible problem. But if you handle it well and effectively, then things calm down, things get quiet. And as you improve your operations with other AI tools to speed up the turnaround time, you also, if you shorten that turnaround time, you now get less calls as well. So there's a virtuous circle there of handle the calls better, more effectively, perform the processing and the releasing of that information, getting it in the right hands more quickly, and just closing that loop also then provides the benefit of you reduce the calls are handled more effectively. They're their experience is positive, and that's what they pass on, and what our clients hear. You can lose clients because you don't have the right call handling, and if you do it right, it will gain you clients. People will hear about it. So, but it's more likely you'll lose clients if you do it wrong.
Sure.
A lot of it is, if you do it right, that's just the ticket to play, in the game.
So
And
that's
a lot of companies don't do it well.
about release of information. But when you look at, let's switch a little bit to like general industry for that matter of fact, right? I think there is a way to look at this in the same fashion that, what, if you really look deeper or look closely, implementing AI or, leveraging AI could actually reduce a lot of reputation in the first place.
Absolutely. That
So
extra tax you pay if you have operational inefficiencies or extended time frames, that if you can make it more efficient, more effective, quicker, accelerate the throughput. It's a little bit like when I worked in manufacturing, and it's lean thinking, right? If you shorten your cycle times and you break it down into proper steps, and you get it through, and you have the proper flow through, you propagate less errors and problems throughout the system. So you can streamline and reduce wait times and reduce chances for errors on larger scales by being able to process it more rapidly. And and it's a virtuous circle in operations when you reduce the processing times and you reduce the burden on supporting those processes. And so that's definitely one of the benefits of AI. People are becoming much more prescriptive. Clients are becoming more prescriptive about wanting to understand and know how you're using AI, and being comfortable with it, and making sure that you're properly handling their information as it relates to AI. Both at training the AI and how the AI operates. So that's an important aspect of educating, the clients out there as to what you're doing and why you're doing it. And in some cases, contractually, signing up for what you're doing, how you're doing it, and making sure it's called out properly. So we have to be conscientious about how our clients are themselves wanting to use it. And in some cases, their boards are telling them, hey, use AI, you got to get out there and do it more. Sometimes we can help by saying, yeah, we'll help you use AI through us, right? But on the other hand, they're worried about AI, and their legal and the compliance and, security officers are going, hey, are you sure that agent you're utilizing is properly using AI and documenting it, and it's safe and effective and compliant and secure and everything else. So it's becoming more and more coming up on the table as we talk to our clients, either existing clients or new clients. So yeah,
it's very insightful, very helpful. Last question from my side. So let's say if someone is very early in their AI journey and feels a bit overwhelmed, where should they start, or how should they approach it? Give us your take on that.
Yeah, I think again, the truth is AI has been changing so rapidly that if you would have become an AI, tried to become an AI expert 2 years ago versus 1 year ago, even versus just the last 6 months, it would have evolved very rapidly. So what I would say, if you're early on your journey, in some ways that's good. Now is a great time to jump in, because the capability, the amount of information out there to learn about AI is readily available, right? So start the journey, learn the terminology, learn the language, learn the platforms, learn what's different between an agentic, AI agent versus, an AI tool. So it depends on the application, right? So it's your foundational starting point needs to be, what do I want to do and why would I want to use AI for this, right? And then educating yourself as to, can AI help? So mapping out your processes. It's hard for you to leverage AI if you don't know what your process is, what you're trying to use it for. And once you're able to kind of get that foundational, what am I wanting to use it for? Am I developing something? Am I using it to manage something? For organizations, it's, what are the tools and the agents and the platforms, for what purposes? Do I map it out? Do I have an AI champion that can help kind of oversight it, versus just saying, that's IT is going to tell us what to do about AI? Well, if everybody owns it, nobody owns it, right? So do you have an owner? Do you have a process for deciding what tools you use? Do you have a thought process on what you want to use it for, and you've mapped that out? Have you characterized it as kind of that low accuracy versus high accuracy dependency, right? It's doesn't get my emails perfect, okay, or it doesn't create a perfect PowerPoint chart, okay, or it's health information, or it's financial information, or it's audit, it's something that's really critical to get it right every single time, right? So that also dictates, kind of the use case kind of dictates, and then familiarizing yourself with the different tools and what do you want to leverage, what do you want your teams to leverage, versus just saying it's the wild west and go use whatever you want, and also ensuring that you're not just throwing your data into free AI where it's the information you utilize for whatever purposes that AI platform wants to use it for, versus it's a controlled, it's you're paying that AI service, and therefore the data is your data and you keep that data. So as an organization, you want to make sure that it's got some degree of thought and control in it. And then again, traceability, documentation to say how we're using it, why we're using it. Can I go back and see what we did, how we did it, why we did it? You'll appreciate that down the road. You might not think about it so much today, but you'll thank yourself a year from now when you go back and think, why did we use that tool, or what did we use it for, or how did it come to that conclusion, or how did it develop that software, that we had it right. You want to have that degree of documentation traceability. So that's what I would say. Start with informing yourself on the language, the platforms, think about why you're using it, how you're going to use it, and then have some processes and operating mechanisms. Have somebody that's championing it, or some champions at least, that are going to be your knowledge experts that are going to help propagate it throughout your organization and train the trainers, if you will.
Awesome. I think, that's great. What is your advice on, now when you are, I think, choosing AI, you also to choose a partner who will help with deploying AI. What is your theory on, how should you choose a partner to do it?
Yeah, I mean, that's an important thing. There's always a question of what do you keep in, what do you insource, and what do you outsource, right? It's going to quote unquote cost you more money, but it saves you in time and effort and the quality of what you get. So it's really that choice of what are the things that it's important for you and your company to own and understand, because it's the crown jewels. It's really vital to the success of your company, and you want to keep it in-house, if you will, and own it, versus there's other things that are more, not necessarily commodities, but things that somebody else can do it better, smarter, faster, because they're bigger and they can scale it and they can do it globally, and they have better pricing, and they're going to develop a better technology platform, or they're going to have more expertise at it, right? And so you're just, it's not worth it to build your own. The other way of defining it is like, okay, because they're just going to be able to do it at scale, cheaper, better, more effectively. And so that's the same, I think, with AI. It's like, what are the things that you really want to understand and know and build internally, versus the things that, somebody else out there, Colbotics, that has built it out and understand it and can scale it and support it and sustain it as well. And in some cases, you might want to develop yourself to do a prototype to understand it, so that then when you engage somebody else, you know what you're doing, and you know what looks good and what doesn't look good, and you've got a better basis for making that decision. But it still makes sense at some point to outsource it. But so it might be a journey as well. Step one is do it in-house, prototype it, understand it, and then outsource it. In some cases, it's pretty well established, but it's just better to bring in the expert and have them do it for you, rather than trying to build it out yourself. There's different red flags and green flags for partners, right? And you can tell, for one, you want to make sure that they're not, a fly by night. They just got started. They don't have really much structure or, process to it. So you want to know that they've got a fair amount of established expertise and knowledge in the space and capabilities. And as you said, you want to know they're a trusted partner, right? You want to know, you can tell by the way they, again, interact, discuss. I can tell pretty quickly when a partner that I'm working with is trying to put all these extra protections and hurdles for themselves in place, versus they're like, hey, we're going to work together, we're going to figure it out. That's a partner versus a vendor, right? So there's certain signals that somebody's just going to be a vendor, which that could be okay, right? If somebody's, resupplying the candy in my candy machine, that can be a vendor. But if it's somebody that I'm working with and I'm partnering with to support patients and clients or my own team or whatever, and I want to make sure that it's done correctly, you want a partner that's going to, if something's, they observe a problem, they're going to bring it to your attention. If there's, a learning curve, they're going to work with you through the learning curve. They're not going to always be trying to protect themselves. They're trying to share the risks and share the rewards, right? And so you can pretty quickly tell the nature of, are they professional? Are they competent? Are they capable? Are they trusted? You always look at referrals and, what do other folks say that have worked with them? And then you see how the interaction goes, how they handle the negotiations, how they handle the actual work, the initial work, and then scale it up from there. And, when there's problems, and there will be problems, how do they handle that? Are they protective? Are they defensive? Are they open? And can you work through those problems together? And if you can find the partner that works with you through the problems and scales up, and they have the ability to scale up, then you've got the right fit.
So what I'm hearing is, if it's mission critical, a vendor won't work. You have to have a partner, and then they have to have the qualities of a partner, meaning, they more than, like a wise man said, their actions speak louder than their words, meaning, their actions will automatically tell you that they are, behaving like a partner. So they are worth the, the trust and, the opportunity.
Yes.
That's a very, very, wise way to kind of just like, if someone is listening this, they need like this one line, I think it will be, if it's mission critical, you need a partner and they need to behave like one.
Exactly. 100%.
That's a great way to put it. All right, Mike, thank you so much for sharing such great insights. This was very intuitive, very, very knowledge intensive, and I highly appreciate all the time.
I appreciate you having me on, and then this is a lot of fun. Thank you so much.
Likewise. Thank you so much.
Thank you, Ollie.